Hello, welcome to an AARP virtual event. We are so happy that you're joining us today. My name is Brenda Price. I'm the Associate State Director in Michigan. And today we have a very informative conversation with representatives from Area Agency on Agings from across the state of Michigan. We want to gain insight on the great programs and services they have to offer our citizens. Also joining me today are colleagues from AARP Michigan. Before we begin, I'd like to share one housekeeping tip. For those of you who are watching us on Facebook, please post any questions that you have into the comments section, and we will address them at the end of the program. We want you to engage. You will have a lot of information to acquire here, and we want you to be able to get your questions answered. So please post your questions in the comments section. So, what is an area agency on aging? These agencies have experts, and they are experts on all aspects of aging, how to assist older adults and caregivers with information and resources. They provide care management services, including 5 core services: nutrition, caregiver resources, health and wellness programs, elder rights, and supportive services. The agency also performs needs assessments and determine eligibility for government-funded programs. There are 16 area agencies on aging in Michigan. So you have one thing to do other than to enjoy this wonderful information that's about to come to you, and that's post your questions in the comments section. My first guest today is Miss Crystal Hood, and she is going to be joining us. Greetings. Hello, Crystal. How are you?
Hello, Brenda. Thank you for having me.
We really appreciate having you. Crystal has been with the Detroit Area Office on Aging since 2012. During her tenure there, she has held multiple positions. She is currently the Director of Information and Assistance. Ms. Hood, you have 2 programs that you're going to share with us today. So let's start with the Caregiver Support Program. Tell us about the program, what it offers, who it services, and anything more that you can share.
Sure, Brenda. I'd be happy to. So our Caregiver Support Program with the Detroit Area Agency on Aging, affectionately known as DAAA, we actually have just begun expounding on this program that we've had all types of caregiver services in our 40 years of existence. However, just of late in the last 2 years, we've really built up a stronger caregiver support program. And with that, we have a coordinator and additional supporting staff who provide resources as well as personal assessments. We actually do personal assessments of individuals and their loved ones. So a caregiver contacts us seeking resources or assistance just to find, things that are going to be helpful to them in their daily activities of caring for their loved one. We take an assessment of not only their loved one's needs, but also the caregiver's needs to try and build a system of offering education services, opportunities for them to relax and not be stressed out, so that we can avoid that caregiver burnout that we all know can be so prevalent in these instances because we have older adults caring for their older adult loved ones. In many cases, they just don't have the skill sets or understand that they are first to identify themselves as a caregiver before actually experiencing and understanding that this is a role that you take on, but they just look at it as if they're taking care of their family.
Yes.
But they have to understand that this is a role that you have accepted lovingly, and we want to make sure that we support you in that. We have multiple programs and training workshops for caregivers that we offer with master trainers, as well as several facilitators of these trainings across the city of Detroit, to assist with keeping caregivers and individuals in our community abreast of up-to-date information, resources that are available, and the like. So our caregiver program, we have Creating Confident Caregivers as an evidence-based program. There's also the Powerful Tools for Caregivers. Aging Mastery is another one, and it's a new program for caregivers with also universal dementia care caregiver boot camps that we offer to help those loved ones who are caring for individuals with dementia in their homes. These are mostly these workshops mostly involve 6 to 8 week workshops, maybe once or twice a week. It just depends on the programs. And due to COVID, obviously, we are not meeting in person for many of these programs, but have been opened up. They have been opened up to virtual meetings. And we're now in the throes of helping to ascertain the equipment and broadband available for the seniors who are interested to participate. So we're in the process of distributing laptops and trainings on how to process the laptops in the community. So,
well, that sounds wonderful. You're covering their personal needs, their ability and capacity to support their family member, and looks like you're stepping up to support the technology end, which is a big gap for many families.
It is a huge gap in the community and with all of our families in the area. Being in the Detroit area, we obviously have lower income individuals who may not have that equipment or access to it. So being able to provide that is a huge, it'll be a huge barrier that we can, take care of and get rid of for our constituents. And we're happy to be able to do so.
That sounds wonderful. You're covering all the bases there. You also have another program, Community Wellness Service Centers. Can you tell us a little bit about that?
Yes. So DAAA, a few years ago, almost 5 years now, we entered into partnerships with several of our community senior centers and service centers around the community. We currently have 4 that we're partnering with. At the Northwest Wellness Center, there is the Neighborhood Services Organization, NSO. We have St. Pat's Senior Center or St. Patrick's Senior Center, the Helm at Bowl Life Center, and LaSed. LaSed is in Southwest Detroit. We have the Helm, which is in the Grosse Pointes, and Senior Center, the St. Patrick's Senior Center, of course, is in Midtown area. And then we have the Northwest Activity Center area for NSO. Those 4 senior centers offer a plethora of evidence-based programs. We have, I believe it's about 11 different programs that we're offering among all 4 of the centers, as well as with DAAA staff who actually participate and provide those trainings, both online. Some are beginning to open back up. Some of the centers are opening back up slowly but safely so that we can have individuals go in because, at this point, our seniors are ready to get back out there and enjoy, the company and the camaraderie of their other, fellow seniors. So we're trying to make sure that everything is safe as possible. Social distancing is being, obviously taken care of based on CDC guidelines. We are taking it slow, but we are definitely trying our best to get them back out there. But the virtual programs have actually taken off, and the seniors seem to like getting online.
Great to hear.
Yeah, we have some that are a little resistant, but they're coming around, so we're happy about that.
Okay, that's good. That's good news, and that's good news to share because the assumption is that's not the news. But that's good news to hear that people are adapting. So tell me, where are the service areas for your agency on agency? I know you serve more than Detroit.
Absolutely. Thank you, Brenda. Detroit Area Agency on Aging, we actually service the Detroit, Highland Park, Hamtramck, Harper Woods, and the 5 Grosse Pointes. So we cover a large area, but we get it done. So we definitely look out for as many other constituents in each of those areas as possible. So we like to get the word out because many people don't realize that we service so many areas.
Okay. Well, listen, we really appreciate hearing from you. And if you have questions for Ms. Hood, please put them in your comment section and they will be addressed at the end. Also, her contact information will be available later in the program, so you can get email and phone number for her office. Thank you. We really appreciate having you. Next, we're going to bring up Ms. Kim Bishop, my colleague from Lansing.
Good afternoon. Thank you, Brenda, and thanks to Crystal for sharing such important information for those in the Detroit area. As Brenda said, my name is Kimberly Bishop. I'm also an Associate State Director who works in community outreach in the state of Michigan. I have the privilege of introducing two guests today, but I'd like to begin with Sarah Sobel. And Sarah is a contract administrator with the Region 2 Area Agency on Aging. A little background about Sarah. She's a licensed social worker, and she currently is a current administrator where much of her work is dedicated to supporting, educating, and advocating for caregivers. Sarah has always had a desire to help others, but most recently she's learning about the balance of helping with self-care, which is something Crystal talked about. Sarah had the privilege of watching her parents care for their parents as they aged, and it's her hope as she navigates the next decade with her parents and in-laws that it might be a time of balance, growth, and laughter, but mostly of love. So thank you, Sarah. Welcome, and thanks for joining us today.
Thanks for having me.
I'd like to start out by asking, what communities does the Western Michigan Area Agency on Aging cover?
So we have the counties of Allegan, Ionia, Kent, Lake, Mason, Mecosta, and Montcalm. And we serve those, in Newaygo, excuse me. We serve those through our Older American Act funding.
Okay. From your bio, it's so clear that caregiving is something that you're passionate about. So it's no surprise that that's the area that you're working in. Can you tell me about the Caregiver Resource Network?
Yeah, the Caregiver Resource Network is something unique to our area. You know, you would think that a lot of these professions and agencies that are in the aging community would be in competition to with each other. But through the Caregiver Resource Network, we're able to take on these agencies, and we have bi-monthly meetings right now via Zoom, usually in person at our area agency on aging location, but right now over Zoom, where we take a variety of topics that these agencies they might be in-home agencies, they might be a lawyer's office, financial office, they might be a retirement home, where these professionals come together and just learn about different programs or different educational opportunities to help them provide better care to the older adults they are serving.
So can you tell me, with some of the services that you're providing in the Caregiver Resource Network, like who's qualified to participate in that?
Yeah, so for our Caregiver Resource Network, that is mostly professionals. Anybody who's interested providing care for older adults or their caregivers, they can meet with that. That's called the Caregiver Resource Network. But through that, the Caregiver Resource Network and a caregiver program that we have is Family Caregiver University. And that is any family caregiver that is providing care, or even you're providing care to your neighbor or someone through church, anyone who can identify themselves as a caregiver. So that is our once a month educational class, also meeting via Zoom right now. But that is more focused on not the professionals, but the family caregivers.
So who can attend that? Are there eligibility requirements to attend the Family Caregiver University?
No. It's open to all. And right now that's been kind of neat via Zoom, is that I think it makes a little bit more of access for people to be able to attend, because, you know, before maybe they had to find respite for their loved one, and now they can just attend while maybe their loved one is watching a show or taking a nap. They can, you know, attend via Zoom.
So what kind of topics do you talk about?
Yeah, so we've been talking about mental health during COVID because we think it's really important. We talk about social isolation. Usually we have a return of somebody talking about the elder law, the beginnings of that. We have also we've had a popular class that we ran a couple of years called Is Mom or Dad Safe to Drive? What to Know and What to Do. Just talking about the basics of, starting that conversation with parents. So our topics are based on evaluations from past caregivers or caregivers that have attended our classes. And then I place the curriculum and the programs based on those evaluations to see what people have a need for and what topics they would like to learn more about.
So does someone have to be from, was it 9 counties that you covered? Do they have to be from those counties to participate?
No, I mean, for convenience sake, when we are in the office, a lot of people are coming from that, from the area, mostly Kent County. But because we're via Zoom right now, anybody is able to participate, and we aren't asking for any donations during this time. We're just doing it free of service.
Thank you. Do you have other thoughts about caregiving or your caregiving university or any of the other programs that you'd like to highlight today?
Another thing that we have started is a once a week caregiver support group via Zoom. I think, as everybody has mentioned, we are just really worried about isolation for our clients right now and isolation for our caregivers. So we are trying to think of creative ways for caregivers to be involved. Our healthy aging is done via Zoom. So any way that we can continue to have some contact with our clients and caregivers, I think, is so important right now when our older adults are looking at isolation.
That's so important. Do you have additional resources that are for caregivers outside of the caregiving university that are for the caregivers as opposed to the professionals in the caregiver resource network?
Yeah, a lot of our programs are focused through the Older American Act. Oftentimes funding will come through the caregiver because we realize that in order to support the older adult and for them to able to maintain independence in their home, we need to also support their caregiver. So there is programs such as Adult Day, other caregiver coaching programs through our agencies that do support the caregiver as well as the client. So on our AAA website, AAAWM, there is many organizations that are listed that we work through with our Older American Act partners that support our caregivers.
Thank you so much, Sarah. And we will also post information about the Western Michigan Area Agency on Aging. So do you have a final thought before we move on to the next Area Agency on Aging?
I just always say to the caregivers that we're working with, just make sure you're continuing to check in with yourself. Caregiving is very hard. So just make sure you're continuing to check in and make sure you're taking care of yourself as well.
Well, thank you so much, Sarah. Thanks for being with us today.
Yeah, thank you.
I'd like to move on and introduce Julie Weatherby. Julie is the Chief Executive Officer for the Region 2 Area Agency on Aging. Julie joined Region 2 as a billing specialist in 2007, advancing to waiver billing manager, assistant finance director, deputy director, and then CEO in 2015. She serves on a number of boards, including the Board of Medicare Medicaid Assistance Program. Julie was also appointed president of the Area Agencies on Aging Association of Michigan in December 2020. Congratulations on that honor, Julie.
Thank you so much, and thank you for having me today.
Thank you. Julie and her husband have lived in Brooklyn, Michigan for over 30 years. They enjoy caring for their dog and cats and having their 2 adult daughters, their sons-in-law, and young grandsons living nearby. So we are really fortunate to have Julie here with us today. And I'd like to start the same way I started with Sarah by asking what communities you cover.
We're in South Central Michigan, so we cover Jackson, Hillsdale, and Lenawee counties.
Okay. I understand that Region 2 has a really unique tiered care services program. Can you tell me a little about that?
Sure, I'd be happy to. So our tiered care program is funded by the Older American Act dollars as well, and it's designed to help older adults that are 60 years or older to get the help they need to remain in the community, to remain successful, safe, and independent. So most of our clients that we serve in this way are medically complex, but they don't need to be. We've found, especially during the pandemic with social isolation and the other things happening, that there's more and more folks that need these services. So we've actually added staff to help more in our community because the need is there. So what our staff does in the tiered care program is they assess each caller individually and help them find out what their own personal needs are and help customize a plan for them that fits those needs. So things that we can offer include, telephonic support right now. We're even dabbling with some telehealth type Zoom options, homemaking, PERS units, personal care units, options counseling, medication management, RN support, community supports, transportation, chore services, respite, home delivered meals, just all sorts of things, whatever will help anyone, any of our community members or neighbors stay successful in their homes is what we'll work to offer. We work really closely with our other community partners to make sure those options are considered as well.
So, Julie, are there age requirements for the program?
Folks generally need to be 60 years old or older.
60, okay. And are there income requirements?
There's not any income requirements. Of course, we have a wait list. So we do, look for those with the most need. But at the same time, anybody is encouraged to call us, talk to our options counselors, and find out what's available in the community, either through us or other community partners to help meet the needs that they have.
Oh, well, thank you. That sounds like a wonderful program. I'd like to transition a little bit and talk about something that we know is a problem, but most people don't really want to talk about, which is elder abuse. I also understand that Region 2 has a program called Safe Haven. Can you tell me about Safe Haven?
Yeah, Safe Haven is a program, and we're going on our 4th year of providing the Safe Haven program. And what it does, and it really is, we found a gap in our community where older adults that were victims of elder abuse didn't have a place to go or didn't have any wraparound services. So what we do is we work really closely with our community partners, including Adult Protective Services, Legal Aid, and others. And we get referrals from all sorts of folks, like especially Adult Protective Services, but doctor's offices. We've had calls from a bank, just all sorts of places. We've had people self-report that they were victims of abuse. So what we do is when we talk to somebody, we find out what their need is. And something unique that we offer is temporary housing. Temporary housing that provides these folks a safe place to stay and live for 6 to 8 weeks while we help them manage whatever the issue is. So we have a couple of apartments we use, as well as hotels in the area. But the key is to have the older adult have a safe place to land while we help them sort through these complex issues, because many times they are very complex.
Have you seen a rise in elder abuse since the pandemic?
We have seen a bit of a rise. One of the issues that have come up is housing. There's always been a need in our area and around the state for accessible, safe housing for older adults. And that has been a problem. And so that it has, caused more referrals during the program year with the pandemic.
So what should someone do if they're concerned that a family member or a friend may be experiencing elder abuse?
What we would suggest is, of course, they can call Adult Protective Services. People are allowed to call Adult Protective Services and make an anonymous report. They can call their local, area agency on aging. If you don't happen to live in our area, there's area agencies on aging all around the state who can point people in the right direction.
So I probably should have asked this question first, but a lot of times people think about abuse as just physical. can you share kind of the range of things that constitute elder abuse so that people will know when it might be appropriate to call to seek help or at least investigate a little further?
Yeah, I mean, elder abuse comes in different forms, like you say. It can be physical, but of course, it can be financial too. If somebody's exploiting someone's bank accounts or things like that, that is considered elder abuse, as well as mental abuse. If they're withholding care or having somebody in really uncomfortable position, that can be elder abuse as well.
So I know that the Safe Haven program is a Region 2 program, but for others who may not be in your service area, if they suspect, who should they call?
I think they should call Adult Protective Services first. If they're not sure about that, they can also call their local area agency on aging, who can direct them to the right numbers, or in extreme cases, calling the police might be important.
Thank you. Thank you so much, Julie. Do you have any other thoughts or programs or anything else that you'd like to share before we transition to the next group?
Well, I just would like to share as part of, and I know it's going to be covered by someone else, but another program that's been really important this year with the pandemic because of the social isolation is Friendly Reassurance. And that's a program where we have volunteers and staff that connect with people as often as weekly, but it can be monthly, and just keep folks connected with the outside world.
Well, thank you. Are you aware of other agencies, area agencies on aging doing it? So if someone's not in one of these 4 focus areas, is that something that you're aware of that may be happening statewide?
I am aware that others are doing, they might call it something different. They might not call it Friendly Reassurance, but they might call it something different. But I know most of us have programs that can connect with people and just talk about what's going on in their life and try to reduce that social isolation.
Thank you. And isolation is clearly an important issue to AARP as well. But Julie, thank you so much for spending some time with us today. I really appreciate you and appreciate Region 2 as a wonderful partner with AARP.
Thank you so much, and happy to be here.
Thank you. So next, I'd like to introduce my colleague, Karen Cavantaris.
Good afternoon. Thank you, Kim. Very much appreciate you introducing me. And I would like to say that I am the Associate State Director for Community Outreach for the Greater Lansing area. So you get all of the Associate State Directors today. So I'd like to bring on the screen now Tammy Lemmer, who I work with at the Tri-County Office on Aging. She is going to talk with us about a couple other topics today. We've had great information about caregiving and elder abuse. So Tammy is the Community Relations Director at the Tri-County Office on Aging, providing leadership and coordination of public policy, community education, communication, and fund development tasks. Before joining Tri-County Office on Aging in November of 2015, Tammy worked as a consultant with the Michigan Department of Education on safe and supportive school initiatives. And she spent 12 years with the Michigan Coalition to End Domestic and Sexual Violence, specializing in prevention and community education through collaboration and partnership building. She's very active in the community, including terms as secretary, president, and assistant governor in Rotary, serving on local school boards and providing mentorship and group facilitation for middle school youth. So welcome, Tammy.
Thank you for having me.
And I am going to start like Kim did and ask, can you tell us where the areas that Tri-County Office on Aging cover, where the services cover?
Sure. So our Tri-County area is Clinton, Eaton, and Ingham counties. So really the heart of the mitten in Michigan.
All right. Excellent. And so we had great information. We're going to talk about a little bit about some health and wellness programs now. So can you tell me what kind of health and wellness programs do you and other area agency on aging offer?
Sure. There's actually quite a great option of programs and services focused on health and wellness that our agencies on aging offer. Not all 16 AAAs offer all of the programs, but most of us offer more than one. For instance, here at TCOA, we offer a couple of programs called Chronic Pain Path, which is focused on helping individuals manage their pain, perhaps looking at alternatives to medical medicinal prescription interventions. We also offer Diabetes Path, which is a diabetes self-management program. So again, helping individuals manage that diagnosis, help them build a better understanding of the disease, how it's impacting their health, how to manage diet, meal planning, etc. And one of our most popular workshops is called Matter of Balance, which is a fall prevention workshop. So those are three, and you actually heard Crystal and others talk about some of our caregiver programs and caregiver supports. Statewide and locally, two of the most popular are Powerful Tools for Caregivers and Creating Confident Caregivers. The latter is specific to individuals who are caring for a loved one with dementia, Alzheimer's disease, etc. But it's one thing that we really pride ourselves on statewide is the connection, the home and community-based services that we offer. Everything we do is about promoting the independence and dignity of older adults, helping them live independently in their homes and in their communities. And so if we aren't offering a particular workshop, we work very closely with community partners. For example, in our area, the local YMCAs offer something called Enhanced Fitness, which is a specialized senior focused education or exercise program. So we're really proud of all of the offerings that we either directly offer or work with partners to offer to promote health and wellness. And Crystal mentioned, and Sarah, I believe as well, these are evidence-based programs, so they are proven to be effective. They're interactive. They're led by facilitators, members of the community, typically 6 to 8 week sessions. So they're not one and done. They're not just quick little information sharing. Not that there's anything wrong with that, but that's what we're doing today, right? That's important to share that information. But they're interactive. There's action planning involved. There's peer support incorporated in those workshops. So it's a great way for people to connect with others and realize they're not in this alone.
Those sound great. And those are across the state, they offer those?
Yep, generally, the Diabetes Path, Chronic Pain Path is a newer one. Again, not all area agencies are going to offer every single one, but most offer most of these. There are a couple that are less common. There's actually a Cancer Path, and PATH actually stands for Personal Action Towards Health. And PATH in and of itself is an evidence-based workshop that talks about general wellness. And then the Diabetes Path and the Chronic Pain Path, the Cancer Path, all follow that model of action planning, support, information sharing, resource sharing, etc. So we will, on each of our websites or in the materials that we share locally with the community, we will highlight the specific workshops that we offer in our local areas.
Excellent. And how have you adapted these programs during the time of the pandemic?
Oh, that's really kind of fun and interesting. I mean, you've heard a few of my colleagues reference that shift to online programming. So that's something that we did. We tried to do that as early on as possible. Again, we know not all seniors have internet access or have devices or even have a comfort level, but we did want to at least make it available to those who had at least limited access. We actually offered orientation sessions, so we didn't assume everybody was comfortable with Zoom or knew how to use the chat or use all the functions. So we essentially added a session 0, a pre-session to our workshops to allow people to come on, ask questions, get familiar with the platform, and really learn how to navigate the online format of the workshop. The other thing that, ironically, going online has enabled us to do is, as we were just discussing, not every AAA offers every workshop, but right now, because they're online, we are cross-promoting. So if it's not something that we offer in our area, we're still talking about it. We're still sharing the information from our colleagues across the state. So in some ways, there's actually greater access to those health and wellness programs now because they are online and anybody can log in from anywhere. So really, we've started cross-promoting throughout the state. Any of the offerings that we offer, our colleagues are sharing that information and vice versa.
Oh,
so that's probably one of the biggest things that we did. It doesn't work for everybody. Some of the workshops, it took us a little while to actually get official permission to launch them online because in being an evidence-based program, they're designed to be delivered in a particular manner and following a particular format. So we needed to get authorizations and make sure that we were following protocols and staying true to the fidelity of the original workshops. But again, it's really, I think it's strengthened the partnerships of the AAAs as it relates to our health and wellness programs because we are in more frequent contact. And again, that cross promotion that's happening at a much greater level than it was before.
Excellent. That's excellent that they're open to more people.
Absolutely.
All right, let's transition. Sarah, Julie talked about the Friendly Reassurance Program that you all do. And can you tell me a little bit about that?
Yeah, absolutely. As she mentioned, I mean, the issue of social isolation for older adults, it's always been an issue. This is not pandemic specific, but unfortunately the pandemic has exacerbated that social isolation that individuals feel when they're living alone. They may not have family members nearby. They may have physical mobility limitations that impact their ability to get out and about, participate in community activities, etc. So one of the things that we did early on, and actually just another example of how the pandemic impacted older adults, programs like Meals on Wheels or home delivered meals in many areas, including ours, we had to go from daily or 5-day-a-week delivery down to 1 day a week to minimize contact. We didn't want lots of people coming and going into the homes of people who are at high risk for contracting COVID. So to counterbalance, we no longer had a volunteer who was going to be connecting daily or at least 5 days a week with a volunteer. We needed to supplement that with our phone calls, with our Friendly Reassurance. So we launched that, and as Julie described, at a minimum, it's typically 1 phone call a week. We have a core, primarily volunteers, making those calls. We started that for any of the current clients that we were working with, or if we got referrals from other community members or partners that we know, or individuals who said, I think my mom or my aunt or my grandma would benefit from this, we would add them to our list. Those calls have been going on for 11 months now. It seems hard to believe. After a while, some of our participants, they'd ask, how long are you going to keep calling us? And, well, we're not, as long as you want us to. If you're feeling good, you're feeling connected, we're glad to hear that. We want to just make sure that you're doing okay, provide some socialization, provide some connection. But, if you're good, we're great.
All right. Well, thank you. And that's excellent information. And when we do the Q&A, I have a couple questions to follow up. So now I want to transition to bring all the AAA representatives back on the screen so that we can take questions that were sent in. On the screen right now, you are seeing the locations and how to reach each of the AAAs that are represented here today. So the Area Agency on West Michigan, the Region 2 Area Agency on Aging, the Detroit Area Agency on Aging, and the Tri-County Office on Aging. And to find any other, or these, if you don't take down the information, to find any other AAA, just go to 4 AMI.org, and there you can find the AAA that serves your area. So welcome back to Crystal, Sarah, and Julie. We've had some great questions come in over the period that people have been talking. And let's see. So one of the questions I want to start with is, I know you all use volunteers because Tammy talked about it. I've worked with Tammy enough to know you use volunteers. Are you looking for volunteers during the pandemic? And if so, what's the best way? Do they contact each of the AAAs? So anybody can answer that.
So I'll go, Karen. So we are accepting any available volunteers with the Detroit Area Agency on Aging. Obviously, we do background checks to ensure the safety of our seniors. We are not currently sending individuals into homes. However, with as Tammy and Julie and Sarah alluded to, we all have the telephone reassurance or friendly reassurance calls that are happening. So just adding to the roster of individuals who are interested and willing to communicate and share their stories and talk to our seniors, we're happy to accept them. So all they need to do is just give us a call and we'll get them to our volunteer representatives and they'll take the information down. Or you can go online and volunteer online as well.
And I'm assuming that's true for all of you.
Yes. It is. Another program that we launched locally, and again, I think some of our AAA colleagues have done this as well. We were even doing emergency grocery shopping for seniors, especially when the shutdown first happened, and maybe caught a lot of folks off guard. You know, I'm being told I can't go grocery shopping. How am I going to get my food? So we launched into action, and in some cases, we're able to shift some of our Meals on Wheels volunteers into that shopping mode.
Very cool. All right, so Susan sent in a question, and I think this was touched on, but are caregiver programs the same in other counties? And I think that they're similar. Is that right? They're not necessarily the same.
Yeah, I think in terms of the evidence-based programs, if any of the AAAs are offering a specific program, it's going to be the same, whether you participate in the UP or in Detroit or anywhere in between. Mm-hmm. I think the issue comes with which evidence-based programs the local AAA might be offering. And again, as I mentioned, the fact that we're online, that's ironically a benefit because now you can connect with a class that might not have otherwise been offered to you locally.
Right. Very good. Right. Kathleen asked, how can we help seniors know, this is for Crystal, how can we help seniors know how to take advantage of the programs offered through senior community centers in Detroit?
So Kathleen, you can always contact the Detroit Area Agency on Aging. Our information and assistance team members are happy to assist you by taking down your demographic information. They will put you in touch with either of the senior centers or community wellness centers that we are partnering with that is closest to you, or some that might, as everyone else has said, because we're offering so many of the online services now, you don't necessarily have to be in that area to participate. But yes, just give us a call and we'll put you in touch with them.
Excellent. All right, so this one isn't for anyone specific. This is on a little bit different. So Jean asked, can you mention the free Get Set Up online classes for seniors that the Michigan Department of Health and Human Services and the AAAs have recommended? These help with social isolation.
Yeah, I would be happy to talk about that. You go to, on the internet, you can go to getsetup.io, and it's a free platform that's offered to all Michigan residents. And there's a variety of classes you can sign up to take on how to use your iPhone for photography, painting, just all sorts of different classes. And it connects you with a group of folks from around the state. And then you can do these projects or learn together and maybe make some new friends. So I encourage everyone to check it out.
Excellent. That's excellent information. I had not heard of that program before. So how are you? This is a collaboration between the Michigan Department of Health and Human Services and the AAAs?
Yeah, it was offered by Aging and Adult Services Agency. It's one of the social isolation programs they put out to prevent social isolation. So it's available to anybody. We're all putting it out and trying to get the word out, but Aging and Adult Services Agency is getting the word out too. So like I say, it's free for everyone to try it out. I encourage you to sign up. I signed up myself and have tried to take a class. So I encourage you all to check it out.
Okay, excellent. I don't know that I see, there are a few questions that are completely off topic, and I guess it's best to ask this sort of in a general way. So I know that when we have members, AARP members, call the AARP office and they want to know things like, I need to get, my roof fixed or replaced, or I need to find, how can I get to my doctor's office? I can't drive anymore. I know that we refer people, not necessarily for specifically those things, but we refer people to the Tri-County Office on Aging to help them connect with services. And can one of you talk about, the variety of things that you can connect people with?
I can take that one. So for us at the Area Agency on Aging of Western Michigan, it's unique with Kent County. We have a Kent County senior millage as well. And a lot of the counties that we serve also have a county millage. So you are going to have some services that are provided through the county with county dollars of their millage, or you're also going to have some services provided with the Older American Act funding. So those programs aren't always the same funded program. So I can only speak for the Area Agency on Aging of Western Michigan that we do have a service directory on our website. We're also able to send that out to anybody that they would like to see it. It's pretty much, I would say, a catalog of services that they can see what is provided in the area, and if that is just in the County of Kent or if it's throughout our region.
Right.
And I would supplement that by saying really one of the core services, and these are the originating services of area agencies on aging, we exist to provide information and assistance. We all have call centers and or staff whose job it is to answer questions. And sometimes those calls are related to programs or services that we offer directly. Or if not, we work very closely with our community-based partners. It might be a community action agency. It might be Salvation Army or some other charitable organization, service organization. So we do our best to be able to either answer that question, solve that problem, connect that person with the information or the resource that's going to meet that need. We try very, very hard. And it's not just a matter of, let me just give you a phone number. We'll spend time with that person. We'll really make sure we're fully understanding what the problem is, who the right partner is to meet that need. And so we'll often do a facilitated referral. We might actually reach out to that organization directly and loop that caller back in. We do our best, and funding streams are different all across the state. Most counties have millages. 2 of our 3 do not in Greater Lansing. So there's some equity issues there, unfortunately, but we do our best. And if it's not something that we can personally fund, we try as hard as we can to connect you with someone who is going to be able to meet that need.
Okay, great. Is there anything that any of you would like to tell our audience about that we haven't covered yet?
I'll just say, we always say, if you don't know who to call your local area agency on aging, and we will help you navigate and figure out the best route to help you with your challenge. So we just encourage anyone to call us, whether it's about a neighbor, a friend, a family member, or yourself. Give us a call and we'll help you figure out and navigate this complicated world we live in.
Good to know.
And I would also like to add, it's never too early to start what your plan is going to be for aging. And, look at the resources that are in your area. If you are a family member visiting your parents for a holiday or a check-in, figure out what resources are available in their area and just build a binder, start building a plan so that when they do age or they are needing some assistance in their home, you know where to turn for those resources.
Absolutely. And I would like to add that active aging seniors are among us. and we are offering as many services and opportunities for them to remain active. And we are living longer, so we are active and continuing to party and dance and enjoy one another's company as much as we possibly can. And then we'll have that opportunity to relax at a later time. But we got some seniors out here who really get going now.
Yeah, excellent. Wonderful. All right. So I want to bring back the slide of how to contact each of your agencies if people are interested, and how to find an agency if one of these four don't serve your area. So if you can always go to the 4AM website, which is the number 4, AMI.org, and there you have a searchable database of and you can look for by county. You can look for the agency that serves you. And then there's the phone numbers and the websites of all of the agencies that are on today here on the screen. And I want to say that this presentation, if you want to recommend it to anybody, or if you'd like to refresh what we've said on this presentation, you can find this and other AARP Michigan virtual events on the AARP Michigan virtual events page, and you can get there by going to aarp.org/MI, so that's the AARP Michigan State Office website, and then clicking on virtual events. And there'll be recordings of previously done events like this, and there'll be the upcoming events that you can register for. So you can watch on demand events that we've done in the past, most of them, not all of them, or you can look and register for the new ones. And we have some great ones coming up. We have one on how to build a standing raised garden bed, because spring's coming soon, right? And we have one on low back pain coming up soon. We have a diabetes series actually ourselves coming up every other week starting May 6th. And so there'll be a lot of great information. So I want to thank all of you, Crystal, Tammy, Julie, and Sarah, for joining us today and giving us all this fantastic information. And thank all of the folks who are watching us, watching this presentation. So have a great rest of your day, and thank you so much.